Hi students, this is me Dr. Rati Tiwari once again. I am bringing next very important topic. It's quite easier topic, but still you find questions here and there from this topic. That's malingering, factitious, and somatic symptom disorders. Okay, so my videos is especially for those students who is preparing for USMLE, PLAB, or NCLEX examinations, the licensing examinations. But also, if you are in medical school or nursing school, you can go through this video. And while you are going through this video, if you think the speed of the video is less, you can always increase the speed in YouTube and just make the very good utilization of your time. Now let's move forward. So here these all conditions like malingering, okay, factitious disorder, all these things comes under abnormal illness behavior. Here in this condition there will always be the challenge to the clinician in diagnostic evaluation. So it will be very difficult to diagnose because if the person has, let's say, fever, weight loss, chest pain, cough, hematitis, the new diagnosis it's become very narrow differential between TB or something, infectious lung pathology or carcinoma. Okay, but at the same time, when the person presents with one of these different disorders which are under abnormal illness behavior, it's very difficult for the clinicians to make a diagnosis because that doesn't follow under any diagnostic protocols. Okay, so one thing we have to understand is that while you are dealing with the patients with abnormal illness behavior, at the time you have to understand whether the intention is or the motivation is conscious or unconscious. Okay, we'll be dealing this in the subsequent slides. Now there are three let's understand these three most common illness anxiety disorders here in this or let's say abnormal illness behavior. So these are malingering, factitious disorder, and somatic symptom disorder. In malingering, the motivation is intentional. It means the patient is the person, let's say the person is knowingly doing this, okay, and the symptoms are intentional. They are knowingly, they plan in their head and they do something, they manifest something, symptoms in their body. So the motivation is intentional, that is they planned it, they consciously did it, and the symptoms is intentional. The symptoms is not by nature, they fake it, okay, they create it. So that's malingering. And the main reason for this is external gain. So external gain can be anything like financial or for legal purposes. Okay, we'll just deal this in the subsequent slides too. And in the factitious disorder, what you have to understand is that the motivation is unconscious. That means the people, they did not plan to do it. They didn't intentionally or let's say they didn't willingly, under full willness or under full cerebral function, they did this. But yes, the symptoms, they did it fake, or let's say they try to create the symptoms. So here's the difference. Okay, so that's the factitious disorder. And these people especially do just to not for external gain like money or for legal or document purposes, but instead they do this for fulfilling their deep psychological needs, okay, to get sympathy from the people. And next is somatic symptom disorder. These are really innocent people. Here neither they plan it nor they fake it, but they are generally in distress, genuinely in distress, and because of that they do not fake it. They just, the symptoms really is happening in their body, they did not fake it, but it's just that doesn't fit any specific diagnostic criteria of other organic diseases. So yes, you have to understand these things. Okay, we'll talk about this in subsequent slides also. So malingering, we said that this is a conscious behavior. In malingering, the people think it and create the fake symptoms. Okay, so it's a intentional fabrication or gross exaggeration of physical or psychological symptoms to achieve some external or secondary gain. Okay, it is not a psychiatric disorder because the people is thinking and creating the fake. So you are thinking, okay, I'll cut my hand because I don't need to go to work tomorrow, something like that. So that's malingering. And people especially do this to avoid work, let's say for military duty, for legal consequences, obtaining financial compensation, or getting disability beliefs, securing prescription medications, okay, and getting housing or social services. So here in malingering there is always a motivation, external motivation, external gain. So because of that they think and they create it. So it's conscious thinking and creating fake symptoms, okay, but they really create the symptoms or create the scenario. So to recognize malingering, you have to understand that the person will have poor treatment compliance, okay. Patient shows minimal interest. So suppose if the person, let's say comes to you and saying just a fake, oh, I'm extremely having my stomach pain today. They really is not skip the school or skip the work job or something like that. Now they come to your clinic and say, I'm extremely having severe stomach pain today. Now they did that intentionally because they had to get that doctor's report for leave of absence, and they are just now they don't have any specific pain in the abdomen, but they are faking it, okay. So that's malingering. And now if you try to do any diagnostic workup or run test on the patient, then the patient or prescribe some medications, the patient just tries to avoid that, okay. That's poor treatment and compliance and malingering. And as soon as the goal is achieved, the system they say that the symptom is already relieved, okay. And yes, they have inconsistent presentation. That means symptoms doesn't align with non-disease patterns, or and it's especially in medical legal context, and that is if you must always have a very high suspicion if the person is undergoing some forensic or compensation seeking situations. Again, malingering is not a mental illness, okay. So most of the time you may have done this in your school life also, just saying, oh, I have my headache today, mom, and I don't want to go to the school. So you pretend headache, and your mom takes you to the hospital. Doctor tries to understand the thing, and since you already left the school, now if the doctor is trying to prescribe something, you feel fearful because you were malingering. You were to gain the external gain. You were faking in front of the doctor, and you say, okay, I'm already healed, mom, I think I look good. That's malingering. Now next is factitious disorder. In factitious disorder, as I said earlier, they intentionally produce symptoms, but that's because of not the external gain but the internal gain. So when it's internal gain, we say it unconscious, okay, because of the unconscious psychological need for attention, care, and sympathy. So the primary gain is the internal gain, not monetary or the financial or something like that. It's the internal gain or psychological attention, care, and sympathy. If to gain that thing, the person intentionally produces some symptoms, then that's factitious disorder. Okay, there is no obvious external benefit, as I said earlier. So now the factitious disorder can be further classified into two types, okay. One is factitious disorder imposed on self, and next is factitious disorder imposed on others. So when you say factitious disorder imposed on self, that's we call as Munchausen syndrome, okay. The person induce actual physical harm to themselves to obtain medical care, okay. So this is factitious disorder imposed on self, also called as Munchausen syndrome. Key characteristics include now just understand here, in this case the person is hollow inside, requires attention, maybe is by himself. So whenever in our society the person is feeling sick or ill, people or the society or the doctors, they comfort them, they show empathy to them. So they just want that empathy, okay, that feeling of being accepted. So because of that, what they do is that they try to create a physical harm, actual physical harm on themselves. So that's factitious disorder on self, that's Munchausen syndrome. So now for that they go to the hospital recurrently for multiple and also multiple facets, multiple hospitals, as they have visited the hospitals multiple times and they have done their own researches, they know multiple medical terminologies. They are sometimes, just to get extra love and care, they are also willing to undergo painful or invasive procedures. Okay, just remember, in malingering they are not willing to go for the painful or invasive procedures, but in factitious disorder they want painful so that the doctor will love them more, the sisters will love them more. And yes, we, as they visited multiple hospitals, we said doctor shopping is seen here. And when the doctors or someone, people will be noticing them, the symptoms worsen, but when they are by themselves, then the symptoms improve, and especially it is seen in case of female. This is also a classical hint. Okay, in the question, always in this type of question, let's say mostly in this type of question, either women or female healthcare workers will be seen. A classic example is that a nurse will be there, and she comes to the hospital multiple times with the same wound on her hand. And when the doctor and she visits multiple doctors, and one day the doctor does the culture and sensitivity, and and the doctor finds the stool microbes on the wound. Okay, the culture sensitivity for stool or microbes. So what she was doing is that she was putting the stool on her hand. When she cut the hand and put the stool over there, so that there will be continuous infections and everything over there. And so she just visited multiple doctors to get the empathy from them without caring for her own health or caring for her own hand. That's factitious disorder on self, which is called Munchausen syndrome. Now, if the factitious disorder is imposed on another, especially the child or the elderly people, then we call it Munchausen syndrome by proxy. Okay, if it's an other, then it's longer, that is Munchausen syndrome by proxy. So in this case, you must really report to the protective services, like child protective services or adult protective services, immediately, because the person is not just harming herself or himself, is harming other people. Okay, and yeah, this is important here. And like here the example is that a mother will bring her child to the hospital again with the similar wound, and when the doctor does the culture sensitivity, the wound has got a stool in it, so stools and microbes in it. So based on that, you can diagnose that. And sometime a person, another classic exam question is that a person, especially a lady, she will have multiple episodes of hypoglycemia, and she will be visiting especially the nurse, she will be visiting doctors again and again. She will be healthcare workers nurse, and why is that? Because she was injecting herself insulin, okay, multiple times insulin, just to lower her blood glucose level, go into the hypoglycemia, be fainted, and be received or be treated by the doctors, and so that she could get empathy. That was again Munchausen syndrome. I mean factitious disorder imposed on self. Okay, that was example of that. But here, if the child or the elder is involved, then we call it Munchausen syndrome by proxy, and in this case we must call child protective services or adult protective services. Now, somatic symptom and related disorder. In somatic symptoms disorder, the person will often be in chronic distress, or let's say depression type of thing, and in this case they do not plan in the head, they didn't plan, and they didn't fake. Okay, so in this case there will be actual symptoms. It's just that the symptoms doesn't match with the classical organic pathology. So they say, I have a headache and my my left cheek is paining, and my right thumb feels numb. So it doesn't match any symptoms as such, right? So in this case we call it somatic symptoms. Okay, and you have to these are physical symptoms causing significant distress, and the person will be really in distress, and either the cause or the effect of the somatic symptoms is the distress. Okay, and there is the people did not intentionally plan, like malingering, so it's unconscious, motivation is unconscious. And you have to understand there will be different clinical symptoms like pain, fatigue, gastrointestinal distress, or sometimes neurological complaint lasting for months or years. Even in this case, okay, the person will visit the doctor again and again, okay, just to get that reassurance. And whenever the doctor will be examining, the workup will be negative and the doctor will not be able to diagnose anything, okay, but still he goes, and all the best thing you can do is reassure the patient. Okay, and you have to understand here the treatment approach. This is important from exam point of view. You have to schedule regular visit with the same physician. Okay, this will come as an ethical question. Okay, the person will have all the classical symptoms of somatic syndrome. He will be in distress, this and that. He had visited multiple doctors. Now what will you do? And the answers will be like, you have to schedule regular visit with the same physician. This may be you. Okay, so regular visit with yourself to avoid to provide continuity of care, address active symptoms, offer reassurance, and avoid unnecessary testing or polypharmacy. So that is the motive for regular visit with the same physician. This must be your answer. Okay. Yes, and yeah, and yes, these people will also have functional impairment in work, relationship, or daily activities. Now, conversion disorder. So in conversion disorder, in this case we call this as functional neurologic symptom disorder. Okay, the symptoms will be sudden onset neurological symptoms. Okay, in somatic symptoms, the symptoms were pain, abdominal pain, body pain, okay, and let's say fatigue or neurological complaints, a mixture of different symptoms, organ systems. But in conversion disorder, it's more neurological. And let's say there will be psychogenic non-epileptic seizures. You understand that? Paralysis or weakness, blindness or vision loss, mutism, could not speak, aphonia, and sensory deficits like anesthesia or paresthesias. Okay, and there won't be any organic cause for that. So this is conversion disorder. Conversion disorder is frequently seen in case of young female, and in this case again there won't be any neurological, the symptoms will be neurological in nature, but there won't be any organic cause for that neurological cause, okay, symptoms. So and the symptoms can be anything from seizure, the person will be manifesting seizure. When you do the EEG, everything is normal. The person will say that he has paralysis or weakness. And the CT scan or the MRI doesn't show any stroke-like symptoms in the imaging. The person will say blindness or vision loss. Again, every other test for the eyes seems normal. Okay, mutism or aphonia. Again, the person cannot talk or this and that, but again, every oral examinations or every neurological examination seems normal. So this is a classical presentation of conversion disorder, which we call functional neurological symptom disorder 2. There is one topic called La Belle Indifférence. I think it's from French word. So it's a condition where a patient suddenly example, okay, a patient it's a condition, okay, let's say it's a condition where patient displays inappropriate lack of concern about their symptoms. Okay, so let's say the patient is it's especially seen in conversion disorder. Okay, so if the person with the conversion disorder here, the person will not be able to move one arm, but instead of panicking or showing anxiety, they appear unbothered or indifferent and say like, oh well, I guess my arm just doesn't move now. So whenever a normal person, if his arm doesn't move, maybe because of a stroke or something, he becomes really anxious, right? But in this case, in conversion disorder, the person will become indifferent for something not moving, and in this condition is called La Belle Indifférence. But you must also understand this is not seen in every conversion disorder. It's not too common, but whenever it's common, then that's in conversion disorder. It's not common in every people or the patient with conversion disorder. It's seen in female, adolescents, and young adults. And symptoms resolve with stress reduction, psychotherapy, and supportive care. Okay, now maybe another topic will be illness anxiety disorder. Previously we used to call this hypochondriasis. It's preoccupation with having or acquiring a serious illness. Okay, so in this condition the patient will not have any somatic symptoms. There won't be any symptoms in the body, but just that they have a preoccupation or thought that they are having some serious illness like cancer, let's say, and because of that they feel really anxious. They like to visit different doctors, and their functional life has been impaired for more than 6 months. Okay, they do blood checking, they seek reassurances and everything. So this is illness anxiety disorder, in which the person will think that something very nasty disease is happening on their body, but to justify that they don't have any symptoms like that, or they have minimal symptoms. That's hypochondriasis or illness anxiety disorder. And the treatment is cognitive behavioral therapy. Okay, and this we target health anxiety combined with regular scheduled follow-up to reduce emergency visit. That we do it here. Now this table is important just for a summary. So whenever there is malingering, always remember the symptoms are intentional. They just fake it, and the motivation, they have some motivation to gain external money, or to get opioids, or to something like that, and it's not a mental illness, it's just a behavior. So that's malingering. Factitious disorder, in fact they want love, sympathy, something like that from the doctors. So the gain is internal gain. Okay, and for that they don't have motivation, so that's unconscious, but the symptoms they really created. Okay, so that's intentional. And for somatic symptom disorder, they are the most innocent one. They don't have any conscious, they didn't fake it, neither they create the symptoms. They are actually feeling the pain or the symptoms. It's just that the symptoms doesn't fit any diagnostic criteria of other organic diseases. So it's true distress and not faking, and you have to repeatedly call the patient to your own clinic, to the same physician. For conversion disorder, again the symptoms are more neurologic. Okay, neurologic, and again in this case the motivation is unconscious and the symptoms are unconscious. So they did not fake it and they did not create the symptoms. It happened all up by themselves. It's just that stressor lead to that condition in young female, young adults, and ladies especially, and the symptoms are neurological in nature. And in illness anxiety, there won't be any symptoms in the body, and the motivation is unconscious. They are not doing this to get anything. It's just that their nature, they think that they have very severe disease in their body, like the cancer, and they start searching and they go to different doctors, but they don't have any symptoms. And it's for this we have to do CBT, cognitive behavioral therapy. Okay, so yes, always access intent and motivation, that is whether it's conscious or unconscious. In malingering, it's external reward. In factitious, internal emotional reward. In somatic symptoms disorder, there is no conscious control, so it's the patient is not faking. You have to give something to the patient, and always bring the patient to your clinic or for the same physician as much as possible to not let polypharmacy or multiple tests running on the patient, and always maintain empathy. Okay, they are suffering to some extent, they are suffering, except in case of malingering. In all other cases the people are actually suffering. So okay, even though the organic pathology is not set up, sometimes it's either emotionally they are suffering, or let's say they are anxious. So your therapeutic alliance and validations are essential for effective management. Okay, so this is this. Okay, I hope after watching these videos you got clear about this topic, especially malingering and factitious disorder, Munchausen syndrome by proxy, somatic disorder, also conversion disorder, also illness anxiety disorder or hypochondriasis. These are these questions they often come in the examinations, and all these symptoms will be all these conditions will be together as in your options. So you have to understand what each of them mean, and you have to take the best one. So I hope this was helpful to you. Please like, share and subscribe this channel, and share it with your friends, and I'll be meeting you in the next video. See you. Bye bye.